Good morning, everybody. My name is Ajay Kumar. I'm Chief Clinical Officer for Hartford Healthcare. As usual, I will start off with some details about number of patients we're carrying in Hartford Healthcare today. We have 397 patients across acute facilities throughout our system. 41 of them are in Hospital Center, Connecticut. 26 are waiting for test results to come back. Mid-State Medical Center has 33 positive and 14 waiting for test results. Hartford Hospital has 190 patients, 190, and 60 are waiting for test results. Wyndham has 5 and 3 are waiting for test results. Bacchus has 8 and 6 are waiting for results. Charlotte Hungerford has 18 and 3 are waiting for test results. St. Vincent has 102 and 10 are waiting for test results. Total, we have 397 patients who are waiting for results, 122 PUI. In our behavioral health and community network, also we have 94 patients we're caring for as well. Interesting part on the numbers is that this is one of the lower number on the acute side we have seen for several times, 397. We were 426 yesterday. However, our PUI is a little higher, so if you put all of them together, we are at plateau at the moment. From yesterday, the numbers hasn't changed. One interesting fact which I like to share, which is really proud and excited about, we had about 59 patients actually who left our facilities last 24 hours. So recovery is a very positive sign, it's a good sign, and I think testament to all the good work happening across our system and all the good work doctors and nurses are doing at this time, which gives a somewhat of positivity around where we are in this process. Beyond the numbers, I think it's important to know that we have done a lot of different things to support our families and patients as well. We have different ways of communicating with our family members through the iPads and Zoom and everything else. And the folks actually who are really in the isolation or in the ICU. So we've done a lot of different things to make sure that social connection in the virtual way is maintained. So I'm very proud of where we are right now as a system and how we have actually reacted in support of the community. Talking about supporting each other, last week a personal letter was sent out from our CEO, Mr. Jeffrey Flax, to all our staff across the Hartford Healthcare. And really, it entailed thanking all the colleagues for the stepping up and answering the call during this uncertain times. And it was a very heartfelt message to make sure that everybody knows how well they're recognized and their services are respected, and there's a deep amount of gratitude in this process. But as a follow-up to that, yesterday, our system and Hartford Healthcare leadership announced a really special recognition for all the members, and it was a special Success Share Award, which will go out to all members across the system, except the leadership, except anybody who's director or above. All the frontline providers, individuals who are on the front line, the cleaning the rooms, and the nurses who are really putting their lives in danger right now. So it's a recognition of our values and working with our commitment to support our colleagues. It's a big a moment for Hartford Healthcare to be able to support in such a big way, and tremendous amount of generosity within the healthcare community. The physicians and the leadership has contributed with a lot of funds as well to support the folks. You'll have more details coming out over the time, but this COVID-19 crisis has got us together in much different way. We were always very proud of the culture and the commitment, the camaraderie this institution had, but these kind of gestures, when the teams come together and help each other out, when the leadership really stands and really support during this difficult economic times, support our colleagues, is really testament of our strength and our capabilities across the Hartford Healthcare. With that said, we've got a lot more work ahead of us. Although we've seen 24 hours of peak in acute numbers, that it's far from over. We're going to have a little bit more increase over the next several days, and hopefully we will see a downward slope. But the plateau will sustain for some time. So we'll still have work to do. Our teams continue to be resilient, continue to be ready as we go forward. Some of the other updates, plasma patient recovery, we still have several donors actually who are lined up to support patients. So far, as indicated yesterday, about 11 patients received in Hartford area and the 3 in St. Vincent. Those patients are stable or doing well so far. So that's the best update I can give you. As you know, it's a research project. Early stage results really don't indicate long-term value, but we still have to keep paying attention to that. We are in need of more donors at this time. That's the critical piece. We're enrolling as fast as we could, but the process in itself takes time, takes a lot of people out of the mix because they could still be positive. So we're still looking for more donors at this time. The question has come up about the hospital capacity. What is the plan for a backup and how do we use them? We continue to have a fair amount of capacity in our inpatient settings across the system at this time. As I had indicated, our elective surgery volume has gone down. There's some decline in volume in generally. But I do want to remind the community and members at this time, the hospital is open for all the care people need at this time. We still have strokes and MIs and other things coming up which are non-COVID related. But at the same time, the way we structure, the way we work through our ED process, through our inpatient service, through our OR process, we're open for urgent surgeries, procedures. We are open for anybody who actually has any illness who requires help. The hospital is still functioning in a normal fashion in a variety of different ways at this time. So I encourage people actually who are either putting the disease off for some time and hopefully not harming themselves because of delay, seek care, reach out to us. We're here to help. We are here to support. And the way the process is working, we have created a very safe environment for the COVID and non-COVID related. One of the testament of the safety is somebody had asked me yesterday about the number of colleagues across the Hartford Healthcare who might be infected. So I did actually look at the number. We have 314 members across the Hartford Healthcare who have been tested positive. Now, if you think about 30,000 employees and many other individuals who work with our facility, who are vendors, who are contracted employees and physicians and other services, this number is rather a good number, a proud number, because we've been able to contain and manage the system very well. 314 number, if you do the math out of 30,000 numbers, is 1% or so people, which is, and if you put all the vendors and other private practice and other partners we have in our system, it's a lot less than 1%. And this is based on all the individuals who've been symptomatic and been tested. And a lot more testing have been done, but the number is 314. And that's some of the work we've started doing, and has talked about the discipline about the infection prevention process, discipline about the PPE use, discipline about how we rolled out our system across the state of Connecticut. We have a special treat for you today. My colleague, Dr. Jonathan Gates, who's our Director for Trauma Service with the Hartford Healthcare, will be joining. I'll be sharing his experience as well. Dr. Gates.
Thank you very much, Dr. Kumar. Thank you for having me this morning. And it gives me great pleasure to really to be able to talk to what I'm experiencing right now, in that Hartford Healthcare really has done a wonderful job in being able to continue delivering these services that Dr. Kumar is talking about. I'm obviously interested in trauma in the critical care part of things and the many other cases that are occurring in the hospital. But the fact is that we are working very carefully to make sure that we are matching the resources to the patient's needs as they come in. And we clearly, in a trauma center, see clusters of patients, which is usually characterized as 4 or more at a time. And then if we have what we call multiple casualties, that would be many patients that might come in, and we've seen that 7, 8 patients at once. And then the mass casualties are situations which are described where the number of patients outstrip the resources that are available. Our concern in trauma centers is that we have mass casualty situations, and in this situation, it's different. The coronavirus pandemic has multiple patients. They're not injured, but they're obviously sick, and they require resources of the hospital. And I'm really continuously impressed the fact that we're able to match our needs with the patients that come in and the services and resources that we have here at the hospital. We're able to keep it away from a mass casualty situation and take care of patients as they come very nicely. I think that the trauma services are routinely trained, drilled, practiced for these multiple casualties and multiple patient scenarios. And I think the rest of the hospital has been doing this along for years in terms of administration and central supply and logistics, so that when this occurred, it's been an easy step up to deliver the care that the patients need. We still have trauma patients that come in. The volume is down, and that is very characteristic of institutions across the country. Believe it or not, it was characteristic in 1918 when the Spanish flu crossed through the world as well. And we're still here. We're still able to take care of trauma patients as they come in the door. We are set up in the emergency department in order to be able to do that and do it safely and make sure that patients who come in are unknown whether or not they're COVID positive. We treat them as though they are until proven otherwise, especially in high-risk situations of intubations and caring for them acutely when they're injured in the emergency department. And we're able to do that, and do that, I think, with more than adequate personal protective equipment that's available to us. And I think that, again, the fact that we have only 314 healthcare workers in the system who have come down with coronavirus, I think, is a testament to the good preparation and good care that we're all able to deliver. Any questions?
Dr. Kumar, Bridget, the Republican American, the circuit seems to be busy coming in. Could you go over the first minute there with the crucial numbers of a plateau?
Yeah, I'm going to get my sheet. We have thank you, Tina. We have 397 patients across the Hartford healthcare acute facilities right now, and about 122 PUI. If you put them together, the numbers is just the same as yesterday. We had the same number of PUI and COVID positive. And what I was mentioning earlier on is that we've seen a number plateauing at least in the last 24 hours, at least in the Hartford healthcare, in total number of patients. But the interesting fact is that we also had 59 individuals who left our facilities in the last 24 hours. So that's a really positive sign.
And do you have the numbers per facility?
Yeah, I did go over that earlier on. How about I send you the details later on? Would that be all right?
Sure.
Thank you.
This is Fox 61, Dr. Kumar. I just want to find out, you're saying that you're seeing this is peaking right now with the cases, and I'm just curious, is this just Hartford Hospital, or are you in touch with the other hospitals? And what is the statistical model that you're using to determine if you're peaking?
Yeah. So we've had collaboration with MIT and Hartford Healthcare lead teams looking at the modeling. We've been looking in for several weeks now. And we designed our own modeling because there was a lot of inconsistencies in what we were finding in different models across the country. It was based on a lot of different scientific data, especially 104 studies looking at that across the world, looking at some of the data from Italy and South Korea and a few other countries. It was based on number of infection rate, infectivity rate, the doubling time of the infections in the community, the social distancing effort, the length of stay in the patients, a lot of different type of variables looking into that. I like to believe it's a very sophisticated model. And our model has actually been true so far. We had predicted that we will see the peak in the state of Connecticut sometime in the end of April or early May. That was a 2-week window we had at the time. As the time has come narrow and we've come closer to that, our peak prediction has been 26th or 27th of April would be the peak in the state of Connecticut. Now, the Connecticut has interesting way it has evolved because of proximity to New York. We saw an increased number in the Fairfield County, and then North Haven, and then the Hartford County. The Fairfield County has actually plateaued to a certain extent now, but we continue to see the rise in the Hartford County, and we were seeing the rise up to 4 to 5% day over day increase in numbers in Hartford County. And that's been the trend, and that's why the total Connecticut numbers, we think it's going to be peaking about 26th, 27th, and that's active cases across the state of Connecticut. Now, obviously, the active cases have a direct correlation with the amount of patients get admitted in the hospital and the impact on the ICU capacity. And we predicted around the same time, between 26th of April till early May, 3rd or 4th of May, we will see somehow kind of a prolonged peak in the ICU or ventilator requirement across the state of Connecticut. That's our model at the moment. And what we have seen in the last 24 hours is that the Hartford healthcare number, that is not county related, that is entire system, because we have hospitals in different counties across the state of Connecticut, our total number have plateaued. Our Fairfield count number has actually plateaued and went down a little bit, but the Hartford region has been remaining the same at this time, and that is the total number of PUI and the COVID positive. Now, as you know, the Hartford County has more than one hospital, more than Hartford Hospital, so I can't comment on what's going on in St. Francis. But the county level data, when we look at the state-based data, It is consistent with our modeling at the moment. It is actually going to see continuous, some modest increase right now up to end of April. And what change has occurred, if you'd asked me about a month or 6 weeks ago, the pronouncement and the peak, how pronounced the peak is going to be, has flattened a little bit. And we're going to be expecting a less pronounced peak, which is a good sign for the state of Connecticut. And I think it's all the good work our governor and other systems and everybody else has done of social distancing. Some of those relates back to our earlier policies we put together in early March, which was related to the travel bans. The Hartford Healthcare was one of the earlier ones to indicate that international and visitor ban, then a visitor policy, the social distancing effort, internally and externally, how we created a virtual environment, and things like that. So all those things have contributed to where we are right now. So depending on which side of the mirror you look from, this actually seems to be a bit of a success story right now, despite unfortunate mortality we've had in Connecticut. It could have been worse. It is where we are right now.
Okay, thank you, and that's quite an answer. The other question I had for you is, have you seen any kind of feedback on the plasma transfusion testing or experimentation that you've been doing?
Yeah, so as you know, we're part of the trial, the national trial, and we've given convalescent plasma to about 11 patients in Hartford region, about 3 patients in St. Vincent right now. And, as I indicated earlier on, the patients actually have, seems to be doing okay right now. They're stable, or some patients actually have improved as well. Now, I do always want to put a caveat, especially in the setting like that with a small number and a very short experiment. These numbers are not indicative of complete success. We need a larger research study. We need outcome data. It needs to be a bit more scientific than the numbers I just projected right now. So the real success we will know after some time when the research data comes out, the national data comes out. But earlier indication seems to be promising.
Thank you.
I do want to comment, convalescent plasma is reserved for a very small subset of the patients who are really, really sick. It's not a usual treatment given to every patient who walk in. I want to send a mixed message around that as well.
Okay.
This is Emily from the current. Oh, sorry,
hi,
Becca. Hey.
Go ahead.
Dr. Kumar, I just wanted to ask about, as we head into the peak, throughout the peak and the next week or so after, can you talk a bit about what hospital capacity will be like, and especially ICU capacity?
You know, I think we are. I'm pretty confident about the Hartford Healthcare that we're going to be fine. We're going to have plenty of capacity to take care of any kind of patients actually who would be coming to our way. We have modeled in such a way that we can ramp up the patient volume to a significant number. Not quite to the normal times we had in December or January, December or November, but at least 50, 60, or 70% more capacity, we will manage very well. The interesting thing we are seeing right now, the patients who are COVID positive or PUI right now, the requirement on the ventilator has gone down, only because we've been using a different type of modality. We have a high flow oxygen devices, we're using that. So complementing different type of treatment options has really benefited us with the total capacity equation.
Thank you.
Hi, this is Rebecca with the Hartford Current.
Hi.
Within Hartford Healthcare or your guys' partners, could you share what can someone do to get a test if they don't have insurance or a primary care physician?
Well, Hartford Healthcare, as you know, we had a big announcement just a couple of days ago to have a really extended capability of testing with a partnership with the Quest. And Quest has become an exclusive partner of the Hartford Healthcare right now to really offer a large-scale testing. What we've been doing at this time, and in fact, yesterday we had, I think, close to 750 folks actually got tested across our system on the community. We're really focusing our effort into the folks actually who do not have primary care physician, who are in underserved areas, the shelters and other area. We're really thinking about how we use our capability to support the community in a bigger and better way at this time. So we are opening more testing options, and in fact, there will be more locations will be opened up across the state of Connecticut over the next several days. We think this is the right approach to serve our community, and we're going to continue to focus on that as we go forward.
And if someone doesn't have insurance?
They can call our call center, and we will take care of them.
Can you expand on that at all?
If somebody doesn't have a insurance or a primary care provider, or we don't look into that factor at all. They can call a number. We will schedule them to get the testing done in any of the sites we have. And if they choose to follow with us, great. If not, then it's fine as well. If they don't have a primary care physician, obviously we will have some physician or one of our members call back with the results and explain what the meaning of that and do what needs to be done at that time. And we're not looking at the insurance. It doesn't matter whether individuals have insurance or not.
Okay, thank you.
Dr. Kumar, it's Bridget, Republican American again. There seems to be some questions coming up about the number of COVID patients dying at nursing homes or being treated in hospitals. Do you have a breakdown of the number of patients that you're seeing that are coming from nursing homes?
You know, I don't actually have an exact number, but I can give you a bit of a trend analysis. We've been looking into that number lately. Till about actually last 3 days ago, we were seeing an increase in number of patients coming from nursing homes or assisted living or group homes. Last 2 days, I have not seen that rapid rise so far. But 2 days is not a marker for any pattern, to be honest, at this time. We continue to be concerned about the increased number of COVID-positive patients in assisted living and nursing homes at this time. So I think that's one of the reasons indicated in the past that the modeling, as sophisticated as we are, could really go wrong because of the outbreaks which could be in the assisted living and nursing homes and group homes can happen and could really change the focus we have right now. So we're keeping a very close eye on that. As you know, Hartford Healthcare team regularly, almost every week, connects with all the nursing homes across the state of Connecticut and assisted living. We provide a lot of guidance and support and any educational material. We've dedicated our infection prevention team to support any of the nursing homes, assisted living, for whatever the assurance that they need at this time. So we're doing our part to making sure we connect with the community.
Thank you.
We just have a couple of other questions regarding surge capacity and our backup facilities. Have you had to use them yet, and do you anticipate having to use them?
Having a backup facilities are really a wonderful thing for Hartford Healthcare and state of Connecticut, without a doubt. I think having those capabilities in case the unknowns we just talked about, the nursing homes, assisted living, and increased volume of patients, because if our society had decided a different way in the social distancing method, we were ready for those. Right now, we have not used any of the facilities. I do not know whether we will need them or not, because we've got a few more weeks ahead of us before we can really hope for somewhat normal pattern of working at this time. So these are wonderful backup options. We're thankful to the National Guard and all the support we've had, and we are still making sure that those facilities are ready to support. It's always good to be prepared when the time comes rather than preparing at the last moment. And I'm really proud of our system and our teams who've been able to really proactively think through this crisis. Well, if there's no further...
Kumar,
yeah.
it's Lisa, News 8. Can you talk about the 314 employees who tested positive on their status and what they're doing?
They're recovering or have recovered or are back to our workforce. There are all sorts of numbers. This is the total number of patients we've had, our colleagues we've had. Nobody has, all of them are recovered, let me put it that way, and they're coming back, looking forward to coming back. They're doing well. They've been monitored. They've been well taken care of. Well, if there's no further question, as you talked about our colleagues, as you know, we always think about how do we make sure we support our teams across the system. We're very proud of 30,000 strong people and a lot of other partners, several private practice partners and other vendors and other members who work with Hartford Healthcare system. We consider this is our responsibility in the community to be able to support what we do here, and the gesture and the work our leadership team has been doing to create an award and recognition for them as a special recognition for their hard work is a wonderful gesture. So I'm really proud of this team and where we are in Hartford Healthcare. With that, we'll end. Tina, unless there's any further questions.
We're good.
No? Well, thank you very much, and we'll be here tomorrow.